Hello, everyone. Welcome to ELI, the place where you get your daily dose of inspiration for entrepreneurship. And today we have with us Jitin Bhasin, who is the founder and CEO of SaveIN, which is making private healthcare accessible and affordable for Indians. Hi, Jitin. Welcome to the show.
Hi, Priya. Thanks for having me here. Excited to be on your show.
I would request you to introduce yourself to our audience and tell us a little bit about your journey prior to venture. So you built this venture around 2022. What all things did you do and how did you arrive at entrepreneurship?
Yeah, so I have been working in the banking and financial space for more than 15 years now.
Wow.
I started my career with insurance. I had a long stint in banking, and since the year 2015, I've been building in fintech. I'm a second time entrepreneur, so SaveIN is my second entrepreneurial venture. Before SaveIN, I also launched another mobile app based lending company and a non bank finance company, which I used to run. And I think at SaveIN, as you said, we make private healthcare accessible and affordable. So the entire idea of SaveIN was that I personally believe that India has reached a stage where all of us Indians want to explore the best possible outcomes in personal health and wellness. And if you see, almost 30 to 40% of people in India also borrow money for medical purposes, actually, amongst the personal loan, statistics that is available. So I think from our perspective, the core driving idea to build SaveIN was that if India has to become a $5 trillion or $10 trillion economy, or whatever that number we are chasing, Indians have to continuously perform at their peak because only then can we be able to drive the right outcomes on GDP scores and we can continue to grow as an economy. Now, for that to happen, people have to be in their best shape, not only physically, but also mentally, socially, emotionally. And all of that boils down to healthcare. And we found that healthcare is expensive, healthcare is very difficult to access, and we thought it is the best time to solve how we can make healthcare a pleasant experience, a seamless experience.
Hmm. Got it. So let's set some context here. So India, when it got independence, initially healthcare was started as a public thing. A lot of government hospitals were open. In fact, even today, government is also spending a lot of money into healthcare. Government hospitals are having good facilities, but still, they are not foolproof. It's not a foolproof system. There are certain illnesses which would need private intervention, and people reach out to private healthcare providers. How did we reach such a stage that healthcare has become so expensive, not accessible for the masses? And I mean, I think there is a parallel system running. One is the government healthcare system, and then there is a private healthcare system. Nobody knows where to go for what, and there is a lot of confusion in the industry. So.
Yeah. Yeah. So, see, as you rightly said, we continue to be a developing economy. And if you look at the expenditure towards healthcare from the government setup, and let's compare, let's say, BRICS countries as they are famously called, right? So, India continues to be a laggard amongst even the BRICS economies, where the target for healthcare spending in India at a government level is probably around 2 to 2.5%. Currently, only 1.3% of GDP is being spent on healthcare from a government perspective.
Mm.
Now, that's a very stark statistic. And you talked about the availability of healthcare facilities. I must tell you that when it comes to, let's say, hospitals and availability of hospitals in India, most hospitals are concentrated in 7 states of India, right?
Mm.
There is a very stark concentration of hospital network in 7 states of India, and this I'm talking about inpatient healthcare, right? So there are two aspects to healthcare. One is when you get hospitalized and you start getting treated, and the second aspect is preventive healthcare.
Mhm.
Now, what has happened is I've given you how the inpatient healthcare is probably woefully inadequate in India, and so is the government expenditure. But when it comes to preventive healthcare, that is also a massive market. And I think over the last 5 years, people have gotten exposed to why preventive healthcare probably is much more important than hospitalization oriented healthcare. And in both these facets, whether it is hospitalization care or preventive care, the amount of government spending in India continues to be inadequate. The coverage is available probably at the bottom of the pyramid. And of course, there's a lot of good work being done in that regard by the present government as well. But again, I think we continue to see that since medical inflation is almost 15% annually,
Mm-hmm.
medical expenses continue to be on the rise, which makes it very expensive for an average person, an average family to be able to spend money towards timely care, whether it is inpatient or outpatient. So I think that problem does exist in India, Priya, and that has remained around for a while.
Got it. And looks like the solution is towards the private healthcare. And I mean, there are countries who have kind of nationalized the whole of healthcare, and there are countries which are pro private healthcare. But looks like India is heading towards a private first healthcare system, and for which the system of finances come into the picture, because most of the times when you go towards the private healthcare, the cost of healthcare is quite expensive, and hence
Right,
you
right.
need to be prepared for that beforehand in case some emergency arise. So
Yeah.
how are you solving that problem?
No, I think as you rightly said, I think public-private partnership will continue, whether it is education, for example, look at the education sector. You have government colleges, government schools, but you have a very large network of private institutions which continue to drive a lot of innovative, let's say, education outcomes, right? Now,
Mhm.
likewise, healthcare, I think private is here to stay. And the more we grow, the more people will become ambitious to get the best possible outcomes in private care. And I think that becomes important even in a country like UK where there is a national health system available, but there is enough data as to how difficult it becomes for even a country of UK's population size for
Mm,
people to be able to access, right? So I think affordability in healthcare is a very critical subject. I talked about the inflation that we witness in healthcare domain. So affordability is a very critical subject, and there comes the need for financing and what we call as embedded financing. So by embedded financing, what I mean is that it is money which is available at the point of transaction. It is
mhm,
money that is made available to a consumer when the consumer is undertaking a particular transaction, and in this case, it be a healthcare transaction. So I think, Priya, I do believe that there are two forms of payments or financing the healthcare expenditure that exists in the country. One is insurance-led financing or
mhm.
payments, and the other is out-of-pocket expenditure.
Right.
Now, in India, out-of-pocket expenditure towards healthcare continues to be more than 70%, 70.
Mm,
So, which means that financing is a necessity. It is the need of the hour to allow people to have access to money when they need to invest into timely healthcare. And I think that is where we at SaveIN are building a complete healthcare ecosystem, which allows people to connect with healthcare practices near them and pay for any healthcare event, any healthcare procedure, any healthcare service, or even healthcare products by splitting their entire expenditure into no cost EMIs or 0% interest monthly payment plans. Just like how people buy a mobile phone or how people buy air conditioners, refrigerators, washing machines, televisions, laptops, and probably even travel. So we are bringing that revolution to private healthcare where you can access the care that you need without any down payment, without breaking the bank, and you can opt for convenient repayment plans where you don't even have to pay any interest, just like you buy an Apple phone, probably, right? So I think that is what we are building. So
mhm.
we are building the access layer of getting you access to the best facilities which are in our network. So we have more than 6,500 facilities in private healthcare in our network. So you can go to any of those facilities and you can opt for private healthcare procedures or treatments by splitting your costs into zero cost EMIs that we make available to people.
Okay. The next question that comes to my mind is when somebody is going to the hospital, he is in an emergency and needs fund right away. How does he first of all find you in the first place, and then even after knowing that your company exists, how do you carry out the initial checks and balances? For
Yeah,
example, checking the credit score,
Yeah.
and there is a lag time between
Yeah.
application and payment and those sort of things. So how do you take care of that?
So I think first of all, we don't operate in hospitalization space is a clarification I would like to make. See, hospitalization events are very few in an individual's lifetime. In fact, data states that an individual does not spend more than 20 or 25 days inside a hospital
Mhm.
throughout a lifetime, which means today Indians require preventive care much more than what they require hospitalization. For example, if you look at this data in the context of yourself or your family, you may be surprised that the number of people who may have been hospitalized or the quantum of days in which they would have spent inside a hospital would be very, very, very minimal, right? So I think at SaveIN, we are singularly focused on private healthcare for out of hospital treatments, what we call as outpatient treatments. So these are treatments like hair transplant. It's a big problem in India. Hair loss is a massive issue. It's expensive. Dermatology, it's a very big and booming market. Aesthetics, cosmetic surgeries, dental, it's a multi-billion dollar market, but no insurance covers, right? Hearing aid, fitness, wellness, gym memberships, and other sports which people want to undertake today. Ayurveda, alternate therapies are on the rise. People want to stay away from allopathy or aggressive allopathy treatments.
Mhm.
And then we also have homeopathy treatments. We have treatments in fertility like IVF, which is a very big problem but not covered by insurance. So if you see all of these events that I talked about or services that I've talked about are very frequent in nature. Like you may be going to a gym every day. You may
Mhm.
go to a dentist every quarter or every 6 months at least, right? You may encounter a dermatology problem for which you may have to go and meet a dermatologist. You may want a particular cosmetic treatment done, which may undertake very steep expense from your pocket. So I
Mhm.
think these are domains in which we started building back in 2022 with the sole agenda that people are anyway spending billions of dollars every year on these treatments.
Right.
All of that is going out of pocket. So I think that's the first answer to your clarification to your first part of your question. Second, how does somebody get to know of SaveIN today, right?
Hmm.
So, Priya, we have India's largest QR code network in healthcare payments. So we have more than 6,500 healthcare facilities in over 100 cities of India. And we have installed QR codes at each of these facilities. So one can walk into, let's say, a dental center, which may be, an affiliated to SaveIN. So
Mhm.
you would see a QR code, SaveIN QR code at the counter. Now, once your problem has been diagnosed and solution has been advised, and a particular estimate has been prepared, let's assume you have to spend 1,20,000 rupees at the dentist. One can simply scan the SaveIN QR code, and within between 30 seconds to 3 minutes by the watch, we will undertake credit assessment on this customer. And if the customer conforms to the credit assessment parameters that we have set, in real time, we will allocate a credit limit. Let's
Okay.
assume the customer gets a limit of 2 lakh rupees. The customer can choose to pay the dental facility.
Mhm.
1.2 lakh was the bill amount that I gave as an illustration. 1.2 lakh can be given to the doctor directly
Mhm.
through the SaveIN ecosystem. Customer can undertake the treatment upfront without any down payment, and the customer can then repay that 1.2 lakh in 12 installments of 10,000 rupees each without any interest. So what it does is very disruptive, right? So you spend a certain amount of money, right, for a treatment, but in this case, you have to spend nothing at the point of treatment. You just get the treatment
Mhm.
and you pay in EMIs at zero cost. The doctors or the healthcare providers, they love this experience because they are able to serve at least 40% more incoming customers.
Hmm.
Customers love this experience because they can get timely care, the highest quality of care without worrying about high upfront expenses. And if we get all the installments back, then we are also smiling because that's how this entire ecosystem is structured. So I think this is where we operate. This is how we operate. So one can find us across thousands of practices. Biggest brands are our partners. For example, VLCC, which is India's largest dermatology brand, is our partner. Tutsi is our partner in dental. In hair, Eugenics Hair and DHI is our partner. We have more than 1,000 dermatologists. We have more than 1,000 gyms. Jiva Ayurveda is our partner. Dr. Batras is our partner in homeopathy. So all leading brands in India in various domains, healthcare domains, have partnered with SaveIN already.
Mm-hmm.
and they offer this convenient checkout finance option to their customers.
Got it. Curious to know if there are any nuances to the whole process. Like it pretty much looks similar to any other short-term loan app. For example, apps like Credit Bee or Navi, they will also do the same thing, but instead of going through a channel, they can simply deposit the money to your bank account. So curious to know if there are any nuances.
Yeah,
For
yeah,
example, the interest rate is probably you will get a lower interest or anything like that.
yeah. No, I think there's a very big difference, and I think there is a lot of noise about personal loans and the abuse of personal loans in India of late, especially in 2024. So platforms like Credit Bee or any other, let's say, lending platform, they give personal loans
Mm-hmm.
to people where the money gets credited to the bank account of the borrower. They do not know for what exact purpose the customer is borrowing this money, and they will charge interest, and in some cases very heavy interest is being charged, which the RBI has been talking about, to customers, right? So that's a very different use case. Whereas in our case, this is a very pure need based financing where the money goes directly to the provider,
Mm-hmm.
right? It is like how you buy a mobile phone, so you don't get money for the mobile phone. The seller is getting the money credited in his or her account. So I think A, we are need based. B, for the customer we are no cost, which means there is no interest at all. So it's a very disruptive model in healthcare. It was never seen before, because this is very different from a personal loan app, right? So I think we have created that ecosystem, Priya, where people can get access for need based solutions, and they can get the right affordability also present for healthcare. So it's a very different business. And one very big difference I would say is, let's say a credit B is an on-bank finance company, right?
Mm-hmm.
Whereas SaveIN is a tech platform. So on SaveIN, there are three ways in which we give money to people. One is we've integrated with the topmost banks in India directly. So HDFC Bank is our partner, ICICI Bank is our partner, IDFC First Bank is our partner. We have more than 15 credit cards which can be used on SaveIn. So you don't have to borrow a fresh loan all the time. You can
Mm-hmm.
use your State Bank of India credit card using the SaveIn mobile ecosystem, and you can convert your spends into zero cost EMIs for 12 months, which otherwise you have to pay in 30 days. If you swipe your credit card on, let's say, a POS machine, you will have to pay whatever money you spend at that dentist, for example, within 30 days. But if you pay using SaveIn, we allow you to use your same credit card and split that money for 12 months. So we have banks, we have credit cards, 15 credit cards, 15 plus credit cards work on SaveIn, and we have non-bank finance partners also. So unlike a Credit B or a Bajaj Finance, who will give you a new loan every single time you use them, in our case, if you're pre-approved by a bank, we don't need anything from you. Everything is done because your KYC, etc., is also already done. If you want to use your credit card, it's like a 30-second checkout process, just like you transact, let's say, on quick commerce or e-commerce. And if you
Got it.
want a non-bank finance company loan, then we can make it available to you in 3 minutes. So I think the big difference as compared to classical NBFCs, old traditional NBFCs, as you mentioned, versus us is that we are a tech platform. We are focused on healthcare outcomes. We want to make money available to people and doctors when they need it the most. And we have multiple channels of getting that money rather than subjecting customer to a fresh loan application and doing that entire process, which can take sometimes hours. In
Mm-hmm.
some cases, it can be done in a few minutes also, but in some cases, it can take hours for bigger ticket because the names that you've mentioned, they predominantly operate in very small tickets, whereas we give loans up to 5 lakh. Now, those
Mm-hmm.
platforms, their average ticket size is 15,000 rupees,
Got it.
right? So I think it's a very, very different business.
Got it. Uh, what happens when somebody defaults on the loan they have taken? So what all recovery mechanisms in place? Because since this is healthcare, you cannot simply go out and ask someone who is not well and you can force them to pay back the EMI. Maybe he's suffering some sort of disease, not in best condition to repay the loan the current time. So how do you deal with that?
Yeah, so I think that's a good question. See, first of all, any loan transaction is a financial transaction. And I think the responsibility is on the customer to repay. So whether it is for healthcare, whether it is for travel, whether it is for consumption, I think the regulator doesn't discern between, let's say, repayment events commensurate to whatever, right? But if you see, we don't focus on hospitalization business. So people who are borrowing money through SaveIN are largely healthy, but they are trying to achieve superior health outcomes. For example, dentistry, right? It's not a life and death situation that somebody is undergoing, right?
Hmm.
And other events that I have mentioned. So I think first and foremost, we operate in categories where the person concerned is not, let's say, incapacitated, or there is no, let's say, life and death event which is associated with such treatments. Secondly, I think before the loan is approved, whether it is approved through bank, whether it is approved using the credit cards that the customer is already holding, or through non-bank finance companies, we have built a machine learning based algorithm or model, as we call it, to assess customers in real time basis traditional credit assessment information like credit bureaus or other information about the customer.
Hmm.
And we undertake assessment basis 200 odd parameters that we collect from the customer in real time in a completely consent driven architecture. And we arrive at the right credit limit for the customer commensurate to where they are in their financial stage in life. And I
Hmm.
think that's a continuous, improvement process that companies like us have to undertake. So at Savin, we pride ourselves for ensuring that responsible lending is done, across people. And I think there is an inherent advantage in a business like ours, Priya. If I give you no cost EMIs, you will not get two teeth extracted instead of one, just because I give
Hmm.
you money without interest, right? So I think there's an inherent advantage in businesses like us where people who borrow for healthcare outcomes, especially outpatient healthcare outcomes, they are borrowing money or they are using this money to achieve superior outcomes, and they do understand what they're borrowing. And I think there's a lot of sensitization in India about credit scores and healthy credit scores. I think there's a lot of education that has happened in India also, and we see that the events of default of course do arise, but I think as compared to the industry statistics, our default rates are 50% lower than that of credit cards already.
Hmm.
And I think that's a testimony to the kind of business model we are building and the assessments that is happening, and also the customer segment we are dealing with. So I think by definition, we believe that healthcare as a subject is much more responsible as compared to somebody buying a television or somebody buying a mobile phone or somebody buying clothes on, let's say, EMIs. So we
Hmm.
believe that healthcare is a much more responsible subject, and that is what at least we have seen in the past almost 3 years of us being in the market.
Got it. So, healthcare financing deals with sensitive personal information. So, if you look at the Indian market and then compare it with US or any other market, I think US, Europe, their healthcare data is very sensitive, and they care a lot about whom to share the data with and how much data. But in Indian context, I think it's not uncommon to see that providers, all the stakeholders, they keep sharing data between each other, and sometimes data gets leaked to unintended parties. So how does Seven ensure that data security and privacy compliance and other overall trustworthiness is there on the platform in a market where data security is not a big concern, like, I mean, nobody is really caring about it.
No, I think that's a very good question, Priya. But see, I think when we started building Savin, the way we are structured, I think I just told you that the kind of partners we have, especially on the lender side. So we work with the number one private bank in India, HDFC Bank. We also work with the number two private bank in India, ICICI Bank, and many others. So I think by design, when we started building this company, data security, encrypted data, consent driven architecture, what information is available to whom within the company and outside of the company became a very important subject for us very early in our journey. So
Hmm.
with some of the banks, we've been partnered with partners with them for over 2 years now, and we are going to complete 3 years in January 2025. So we are yet to be 3 year old. So for a large part of our existence, we have worked with very large financial institutions. And I think we've been lucky in that regard because there's been a lot of talk about data privacy now, at least in India. There is DPDP Act, which is already there, and there's a lot of conversation around security. Now, as a consequence of that, today, Savin is already an ISO 27001 certified company. So we have structures within the organization where we look at data and we look at, let's say, information security and sustainable practices very carefully. We are audited by certain paneled auditors for information security. All our data is encrypted already, and it is not available for, let's say, use otherwise. So I think, and it's a continuous, let's say, evolution journey. Like in the US, you mentioned there is a act called HIPAA. So there's a HIPAA
Hmm.
compliance, right? So I think we are undertaking that as well. So from a business perspective, we at SaveIN are very, very focused on data security, very focused on what information we seek from customers or merchants, A, about the person, B, about the treatment, how do we store it? And I think that has become part of our DNA. We are committed to improve it as we grow, because I think, as I said, and I'm saying this repeatedly, it's an evolutionary process. But at the core of what we are building, we have benefited from very, evolved partners like big banks who we are working with, who have also imposed upon us, if I may use that term, the need to be extremely compliant. Otherwise, such partnerships cannot exist in the current ecosystem. And I think that has benefited us immensely. It has
Hmm.
also instilled in us a framework which otherwise we would have taken much longer to learn as a young company. So I think that's how we are structured, and actually we are very happy with the amount of focus we put on data and security.
Got it. Speaking of partnerships, was it difficult to convince the healthcare providers to adopt to embedded financing? Because they are quite used to insurance based financing, or I mean, why should they care about money? Because it's a patient job to get money.
Yeah. No, I think I bring you back to the same point because I think your question assumes that we work in hospitalization. Please note that I just told you that the domains where we operate, there is no insurance.
Hmm.
You could have a 1 crore health insurance, but if you have to spend 1 lakh at a dentist, your insurance will give you not zero.
Hmm.
So we chose practices where the penetration of insurance is zero. Hair transplant cost 2 to 3 lakh rupees minimum. No insurance will cover it. Dermatology procedures, everybody is spending today in India, multi-billion dollar industry, not covered by insurance. Eye, if you have to remove your glasses using LASIK surgery, insurance does not cover it. Dental, insurance does not cover. Gym memberships or fitness subscriptions or some other, let's say, money that you spend on fitness, no insurance covers it. Ayurveda, homeopathy, bulk of the treatments not covered by insurance. IVF, not covered by insurance. So I
Hmm.
think by definition, when we started SaveIn, we looked at healthcare. We identified that outpatient healthcare, which is non-hospitalization, is 1,000 times more frequent than hospitalization.
Okay.
And unfortunately, those frequent treatments are not covered by insurance. So we became an automatic fit. We
Hmm.
became an automatic fit, and the entire community embraced us. They loved the experience. They were like, wow, we finally have a product which we can use to offer easy payment plans to our customers. I'm a dentist, I run a clinic, and suddenly I have SaveIn. So I'm able to, address 50% more customers, or I'm able to advise my customers to get superior treatments, which will cost them more money, but now money is not that big a problem. So I think by definition, we chose our market quite smartly. There was a gap in that market, a big glaring gap in that market. Insurance does not cover it, and we fit that place like a glove fits a hand. So I think merchants have loved us. We have built India's largest network of outpatient healthcare. More than 6,500 practices are on SaveIn,
Hmm.
and we are the largest aggregator already of this nature in India.
Okay. Then what's on the roadmap? Like, do you envision expanding into other healthcare segments or introducing new products or
Yes,
going
yes.
outside India, maybe?
Yeah, absolutely. So I think we are at the cusp of launching a very, very disruptive product, which I would love to talk about. So
Okay.
traditionally, we have remained in the space of zero cost EMIs for healthcare, as I told you, right? But
Hmm.
I believe that preventive healthcare and is going to become a mainstream subject, and the workplace, the employers are extremely focused on physical fitness, mental fitness, emotional fitness, preventive healthcare, nutrition, health screenings, etc. Now, if you look at the entire ecosystem of employer healthcare programs in India, only 18% employers offer any sort of healthcare coverage to their employees.
Hmm.
And whoever offers, they offer only hospitalization covers. Now,
Okay.
hospitalization is not encountered by more than 5% of the workforce,
Mm.
right? So I think we have discovered a big gaping hole in that line of domain, and we are launching a new product by the name WellUp. WellUp is, basically it means upgrade your wellness. So we are launching India's first outpatient and preventive employee wellness program, wherein by means of launching a mobile app, we will, through the employer community, we will cover millions of employees. And once an employee gets that mobile app through the company where he or she works, they will get preventive health checkups. They will get doctor consultations throughout the year. Doctor consultation not only for allopathy, but also for homeopathy, also for Ayurveda.
Okay.
They will have mental counseling with professional psychologists available through video calls.
Mhm.
They will have personalized diet plans available through that particular platform, right? So that they can generate better physical outcomes for themselves, better mental outcomes for them. They will have dental consultation and dental cleaning within the program. Annual cleanings will be scheduled for them. And all of this will be free of cost for the employee.
Mm.
On top of that, they can access any network partner of ours, more than 6,500 partners. They can go anywhere for any treatment where they will get special discounts, and they can also pay in zero cost EMIs. So we are launching India's most disruptive wellness program, which we intend to offer through employers starting 1st of January. So we have already onboarded thousands of employees in the pre-launch of the product, and it is being loved by the industry because the Gen Z doesn't care about hospitalization. They don't get
Mm.
hospitalized, right? I mean, touch wood. So I think they need preventive, they need fitness, they need diet, they need mental, and traditional products are hollow. They don't offer
Mm.
any of that. So I think there have been many events in India where, of late, if you see some unfortunate events happened where people committed suicide because of mental pressure, or they were not happy with the way they were physically. Aesthetics, become very important sometimes. People are not
Mm.
happy with their looks, and that impairs their productivity. So I think there's a lot of focus in India about creating the best possible workplace, and we believe it is time to disrupt old plans and embrace the new. So we are launching what we call modern employee wellness program, which goes beyond hospitalization, because hospitalization is where you've lost the battle already. you know.
Mm.
So I think we fundamentally believe that people should be prevented from getting into a hospital, and everything that is needed to make sure of that is something that SaveIN will do, and that is what we are committed to building.
Got it. My final question, and then we'll wrap up. Uh, can you tell what is that one aspect of Indian healthcare system that needs to improve, or maybe if you were the regulator, what would you change about Indian healthcare?
I think there are two aspects that I would like to really impact. One is transparency in the healthcare ecosystem. So when and this could be, let's say, inpatient, outpatient, both. So what exact information are you provided for the particular treatment or service that you're undertaking, and what are the outcomes that you can expect? I think is something which definitely can improve significantly.
Hmm.
And the other thing is, let's say, and this also includes pricing. So, what treatment, what outcome, what price? I think that is what I mean by transparency. And the second thing is consistency. I think people are very scared about wrong advice,
Hmm.
and they want to resort to second or third or fourth opinion in certain cases.
Yes.
So I think consistency and transparency are two items that I would really expect can improve significantly. And I think these are two areas, if we do a good job at it, then people will trust healthcare facilities much more.
Well, thanks for joining the session, Jitin. It was a pleasure to have you on our platform, and I think we learned a lot of things about Indian healthcare and how it is changing. And certainly, the newest fintech companies are making a massive impact into the whole ecosystem. Thanks again for joining, and I wish the best.
Thank you. Thank you, Priya.